कश्मीर सुनते ही क्या सोचते हैं आप? डल लेक, शिकारा, आतंकवाद, आर्टिकल 370। कश्मीर सिर्फ इन्हीं सब चीजों से नहीं बना है। कश्मीर में आप जैसे आम लोग भी रहते हैं और उन्हें बुनियादी चीजें भी की भी जरूरत है, जैसे कि हेल्थ केयर सिस्टम। आज न्यूज फ्रंट में हमने इनवाइट किया है डॉक्टर जुबैर राशिद को, जो कश्मीर में एक हार्ट सर्जन हैं, और हमसे वो डिस्कस करेंगे कि कश्मीर के हेल्थ केयर सिस्टम में क्या क्या कमियां हैं, किस तरह की जरूरतें हैं और किस तरह से इम्प्रूवमेंट की जा सकती है। डॉक्टर जुबैर, वेलकम टू न्यूज फ्रंट।
Thank you, Alka.
And it's a pleasure to have a doctor from Kashmir with us talking about basic needs, कि वहाँ के लोगों को, आम लोगों को किन चीजों की कमी है और एग्जैक्टली सरकार या हम लोग या पूरा भारत देश मिलकर किस तरह से अपलिफ्ट कर सकता है इन कमियों को। तो आप बताइए, हार्ट सर्जरी को लेकर किस तरह की क्या कहते हैं लैकिंग है फ्रॉम गवर्नमेंट साइड या फ्रॉम स्टेट गवर्नमेंट और फ्रॉम सेंट्रल गवर्नमेंट?
This is a very special specialty in medicine, that cardiovascular and thoracic surgery. So here in Kashmir, the healthcare system is a little bit different from the rest of the India. So, but there is a scope of improvement in here. Like we have infrastructure, we have equipment, we have manpower, but we does not have proper support here. So, like I say, whole of the Kashmir Valley, it has around 2 million, 2.5 million population, and it is all the heart diseases are catered by few of the hospitals. One is a government hospital which is actively doing heart surgeries, and there are 2 or 3 more centers which are actively participating in heart surgeries. So one of them is mine. I am heading a cardiac department in one of the hospitals in the Srinagar city called Noora Hospital. So, but the overall scenario for healthcare in heart diseases is poor. So we need to improve it, and there is a scope of improvement. So like we want to aware people that we are here to serve them, and we are here to improve the quality of life. It is, as you said, that it is much more than Article 370, terrorism, and all these scenarios which media is following. So the people which are our people, the people of Kashmir, they are not that much financially sound, most of the people, and for heart diseases they have to travel either out of state or out of country to which is not possible for every patient. So the patients which are from middle class or lower class, they come to us, and we do their surgeries, we do their open heart surgeries under Prime Minister's Ayushman Bharat scheme. So at a grassroots level, we are just trying to improve our healthcare system as far as Kashmir is concerned. So we need support, and we need the awareness. We want to aware the people about it. So this is how we can improve this healthcare condition in Kashmir, particularly in with respect to heart diseases, because heart diseases are so rampant. These are very common: diabetes, blood pressure, and all these thyroid diseases. They all are related, and they affect heart also. And then people are like succumbing to small things, and they do not get treatment what exactly they deserve.
अच्छा, आप बोल रहे हैं कि जैसे डायबिटीज है, ब्लड प्रेशर है, जो इंडिकेशंस होती है हार्ट डिजीज की, बट आपको ये नहीं लगता कि हमें डायग्नोस्टिक सेंटर्स को भी वहां पर काफी होने चाहिए कश्मीर में? क्योंकि कुछ लोग, क्या होता है कि सीधा डायरेक्ट हॉस्पिटल पहुंचते हैं, टेस्ट नहीं करा पाते हैं, जो कि मतलब अगर आप दिल्ली जैसे शहर में देखेंगे तो इतने पैकेजेस होते हैं, लोग हर 3 महीने में 6 महीने में दे आर गेटिंग टेस्ट डन, तो उनको पता होता है कि उनके बॉडी के साथ क्या चल रहा है, बट आई थिंक उतना अवेयरनेस नहीं है कश्मीर में। तो उसके लिए एज अ डॉक्टर आप क्या सजेस्ट करेंगे?
Yes, Alka, you are right. There should be diagnostic centers also which are there and which are doing well under Ayushman Bharat scheme. But the schemes like we do have executive health checkups, screening programs are there outside Valley, but those are not here. The companies which sponsor these programs and schemes, they do not have any outlet or they do not have anything here. So the people of Kashmir come to hospitals directly. Whatever they want to do, they will have to do in hospital also only. So this is the thing. Yes, you are right. Yeah, we can have a diagnostic center kind of a thing which does these screening programs, heart screening programs, diabetic screening, so that people become aware and they treat themselves prior to any mishap.
Mhm.
So, but this is lacking in Kashmir. So yes, we do. These companies can tie up with small diagnostic centers here in the valley or in Srinagar city, and they can just tie up with them, and they can have these schemes and offers for screening of the patients like this. Yes.
क्योंकि बिकॉज बॉर्डर एरियाज में कुछ लोग हैं जहां तक हेल्थ केयर शायद पहुंच ही नहीं पाता, डिस्पाइट बीइंग, आई मीन आई वाज रीडिंग दैट देयर आर अराउंड 2800 हॉस्पिटल्स इन जम्मू एंड कश्मीर, बट स्टिल बॉर्डर एरियाज और रूरल एरियाज जहां पहुंच ही नहीं पा रहा है हेल्थ केयर सिस्टम, उसको स्ट्रेंथन करने के लिए आपको क्या लगता है क्या करना चाहिए गवर्नमेंट को या एज अ मेडिकल फेटर्निटी को?
Yes, that is true. That is what I'm telling you. There are a lot of hospitals, but they are like primary hospitals. They do small kind of things. But even if a patient is there which requires immediate attention, like a patient of heart disease, a patient when he suffers a heart attack, he should reach a hospital which has a cath lab within 60 minutes. Otherwise, he will not survive. So we will have to establish these cath labs and in primary care centers, like all those hospitals which are primary centers from the near the border areas or near the villages. So they can put a cath lab. We can establish a cath lab with the help of our cardiologist colleagues in the valley, which are very excellent in treating heart diseases. And then they can do their procedures, and we can do ours. So besides, we have medical colleges also. Very few medical colleges have that facility of cath labs and cardiac setups. So we need to have more cath labs and cardiac setups to improve our healthcare condition.
ओके, पेंडेमिक में जैसे बता रहे हैं कि आप दिल्ली जैसे शहर में भी कितनी दिक्कतें हुई थी, तो कश्मीर में क्या क्या प्रॉब्लम आपको एज अ डॉक्टर फॉर रिसोर्सेज के लिए कैसी कैसी प्रॉब्लम फेस करनी पड़ी, और उससे उसका सॉल्यूशन आप अगर आगे भी ऐसी कोई सिचुएशन होती है तो आप क्या सॉल्यूशन देखते हैं कि होना चाहिए?
See, pandemic was same for each and every one of us. So each and every one of us suffered in one way or the other way. But in Kashmir, it was really very bad, and people were like, there were no facilities of ICU, and ventilators were lacking as it was anywhere else.
Yeah.
So, but yes, but the thing was that yes, we struggled a lot. We have overcome it. But in Kashmir, it was like the scenario was different. There were more mortalities, there were more deaths, and there were more people which were suffering because of lack of oxygen, lack of proper healthcare facilities, like you said, in border areas. There is not even a single ICU bed in a primary hospital which can cater this, which can treat this severe disease. So there was a lot of so we anticipated. Then the anticipation was important. Like now we anticipate if something like this comes, we should have a proper backup for it, which consists of ICUs and ventilators, oxygenators, and all these. And besides, there were without other than COVID, it was like other diseases were also there. So which affected, like it was a lung disease and it was affecting heart also. So
Mm-hmm.
it was a mixture of all these things, which was it was very critical phase for all of us.
Of course.
So the thing is that we have to establish healthcare in primary grassroots level, so that everything is catered in a proper way and in a protocolized manner.
Yeah. बिकॉज अभी तो इस ऐसे भी इंसिडेंसेस हो रहे हैं आफ्टर कोविड कि यंग लोग लाइक इन देयर 20s अर्ली 20s उनको भी कार्डियक अरेस्ट हो रहा है, हार्ट अटैक हो रहा है. सो व्हाट डू यू थिंक, मतलब इट्स रियली नीडेड कि ग्राउंड रूट लेवल पे लोगों को एजुकेट किया जाए. तो उसके लिए क्या आपकी तरफ से कोई वर्कशॉप्स होती हैं या कुछ ऐसे सेमिनार्स होते हैं?
Yes, we have started Neuro Hospital, as I said, where I'm working right now. So we have started free camps, free cardiology campus, which gives people free consultations. We do it outside the Srinagar city, in the villages or in the border areas. Last month we had cardiology and cardiac surgery combined camp in one of the border areas, which is called Kupwara, and there were a lot of patients. And they were not aware of all these. Then when we offered them that the patient with a heart disease, they come here and then they avail the free medical checkup, free heart checkup for themselves on a very nominal rates, and even it was free for most of the patients. So a lot of patients came, and we are anticipating that there are a lot of lacunae in the healthcare system outside the city, which needs to be taken care of. So yes, these cardiology camps and free screening programs, free investigations is the need of time right now.
जैसा कि आपने कहा कि मैन पावर की कमी है, सो डू यू थिंक कि अगर दूसरे स्टेट से कोलैबोरेट, दूसरे हॉस्पिटल्स कोलैबोरेट करें कश्मीर में या अपने डॉक्टर्स भेजे, तो उससे कुछ इम्प्रूवमेंट होगी हेल्थ केयर सिस्टम में या सर्जरीज में? क्योंकि बेसिकली सर्जरीज इज द थिंग जो शायद आम लोगों तक नहीं पहुंच पा रही. दवाइयां तो पहुंच पा रही हैं, बट सर्जरी एक ऐसी रिक्वायरमेंट है, और स्पेशली हार्ट सर्जरी. तो डू यू थिंक ऐसा कुछ कोलैबोरेशन हो तो बेटर रहेगा?
Yes, of course. There are some corporate hospitals coming in the city. Unlike any other city like Delhi, Delhi, or say it is Mumbai or any other metropolitan city, or if it is even a small city, there are a lot of corporate hospitals. But even in the heart of the city, there is no corporate hospital as we see in other cities. So yes, we can collaborate with the other hospitals which have their own protocolized treatments and which are doing good in the market. So they can come and we can collaborate with them, and we can make this place better for living.
मेडिकल एजुकेशन के बारे में आप क्या कहना चाहेंगे? क्योंकि अगर वहां पर ही बच्चे पढ़े, मेडिकल शिक्षा अगर उन्हें मिले और वहीं पे डॉक्टर बने, तो इट वुड बी बेटर फॉर कश्मीर एज अ स्टेट. सो मेडिकल, बट एजुकेशन आई थिंक कभी हैम्पर हो जाती है. कभी पैंडेमिक आ गया, कभी कुछ कभी वो इंटरनेट बंद हो जाता है, कभी स्कूल्स बंद हो जाते हैं. सो उसको बेटर करने के लिए क्या कर सकते हैं?
See, the circumstances in Kashmir are like erratic. One day there is something, and another day there is something else. But medical education, like any other part of education, is also suffering from this. But the thing is, there is an improvement for all of this. We can teach our kids, we can teach the medical students online, and they can come to us as a private, the students which are in government colleges. If they are lacking something, they can come and they can collaborate with the private corporate hospitals where the treatments and where the education is more frequent. They can come and join us, and then we can improve it better. Because the Kashmir is a small state, and the communication is easy. So they can travel from one part of Kashmir to other part for education and all this. Even if internet is not working, they can just talk on phone and all these. They can consult with their seniors. They can consult with their teachers. So with this all, it is a sort of teamwork, and it is a sort of like we have to compromise on small things and make them happen. So by this, we can just improve the medical education also. So we are also running a paramedical college in our hospital, and we have an excellent academic scenario here. So people are coming and they are seeking it. So likewise, we can do it.
Okay, okay, sir. Okay, and whatever, I mean, I just want to ask कि आपने कहाँ से education, medical education की है, and why you chose to be in Kashmir despite being facing so many struggles?
Yeah, basically, I am basically from Kashmir, and but my whole of the medical education was outside Kashmir.
Okay.
So it was, I was in Delhi, I have worked in Delhi, I have worked in Hyderabad.
Okay.
Then, but I came back here with the intention that I will give something to my people. And and it was a very good opportunity here in Nora Hospital. We established a cardiac setup here, and I thank the CEO and MD of Nora Hospital. He gave me the opportunity, and we started doing cases, and that too under Ayushman Bharat scheme, which gives free access to treatment for all the people.
Okay.
And we are doing good, and we have done almost about 100 cases in 6 months. Okay. So in this way, I am just trying to make this place a better, at least on my level and on a grassroots level. So nobody, there are very, as I said, there are very few cardiac setups in Kashmir. And in Srinagar city only, there are only 2 or 3 centers which actually do cardiac surgeries. So one is, mine is one of them. So like, so we are making it like happen.
No, I think कश्मीर को इसी तरह के लोग और इसी तरह का जज्बा चाहिए, so that जो कश्मीर को सही मायने में स्वर्ग आप जैसे लोग ही बनाते हैं with your efforts. And I hope कि जो आपका जो आपका जो endeavor है, जो आप ये efforts कर रहे हैं, ये fruitful हो और कश्मीर एकदम turnover करे, makeover करे and becomes the best city in our country.
Thank you, Alka. Hope so. Yes, we hope for the best.
Yes, we too. And thank you, Dr. Zubair.